Good morning, good afternoon, everyone. Thank you for joining our webinar today. Welcome to those of you who have not joined us before, and welcome back to those who have been with us throughout the weeks as we've been going over all of the updates related to COVID-19. We are today on the phone. I have Chad Schiffman, our Director of Compliance, and I also have Nicole Mark, who is our Marketing Manager. She is going to be moderating our questions today as we go through, and then Chad is also going to be co-presenting with me. I'm Loretta Maddox. And what I want to do, to remind those of you who were on the webinar last week and to let those know who are joining us today, we want this to be as beneficial to you as possible. So as we go through the information today, there's a lot of information that we're covering, but we're also gearing up for our next week's presentation, which is really going to be geared toward getting back to work. So as you think about that, and as we are talking through the topics today, please feel free to send in your questions to Nicole so that she can start putting those together. We are going to look at those questions. We're going to answer the ones that we can today at the end of the webinar, but we're going to take those questions and actually incorporate some of those into the information that we're going to be providing next week, which I know many of you have probably started back. So you are going to be experiencing things that maybe you haven't experienced before. So please share that information, ask those questions, because that's why we're here. We want to be able to provide you with the information that you need. So we, just as a quick reminder, want to remind you about the COVID-19 Toolkit. This is constantly being updated. There were updates made this week to courses and a couple of new policies added. So I believe we're going to touch on those a little bit throughout the presentation today. But just as a reminder, if you do not have access to this, please contact your compliance advisor. If you have trouble finding it, definitely let us know and we'll make sure to get you in the right place. So our update for today, April 28th, let's just get right into this. The first thing that we wanted to talk about is, we did this last week, and it's just amazing the things that people try to do in situations like this. So we thought we'd highlight a couple of them. We have a chiropractor that was promoting fake COVID-19 treatment, and that didn't go so well for him. But the Department of Justice did crack down on that. Just to give you a couple of pieces of information about this, this particular chiropractor was offering homeopathic products that were both a C-19 vaccine and also a treatment that would reduce the severity and duration of symptoms. There were videos posted to the practice's Facebook account saying that up to 90%, it would offer up to 90% protection. These kind of things just continue to blow my mind, but the Department of Justice is really cracking down on this, along with other organizations that are trying to make sure that individuals are not trying to take advantage of this situation. We have another example. This Dallas Health Center was touting ozone therapy as a COVID-19 treatment, and actually, in this situation, one of the owners told an investigator posing as a potential customer that although ozone could be dangerous, their treatment was safe and effective, even for children, and would sanitize anything. So clearly, this has been stopped, so that's no longer happening. But another thing that I wanted to point out is that, as I mentioned before, the Department of Justice is really cracking down on this, and they're doing this along with the FBI, the FDA. All of these organizations are getting together to make sure that they can stop these things. The Department of Justice had announced that they have actually disrupted hundreds of online COVID-19 related scams. And so based on this, we thought it would be a good idea to just do a brief reminder. I know we've talked about it before, but I think it's a good idea to just, maybe not necessarily for yourselves, but maybe your staff, people on your workforce that need a good refresher against or how to recognize potential schemes. And so here are a list of tips from the DOJ that I just want to go over briefly, and Chad, chime in if there's anything that you want to add. But making sure that you're verifying the identity of a company or anyone that's going to reach out to you regarding COVID-19, and especially when it's coming through email about any particular products or services. We know we have shortages of some PPE, so there may be increased efforts for cyber actors to try to push that information because they know there's a shortage, and so maybe they're sending emails offering products and it's not valid. So we want to make sure that we're doing some due diligence on our end, on your end, before you are making those decisions. This is always a good reminder, don't click on links or open email attachments from unknown or unverified sources. And this is just a good reminder for the entire workforce, especially now that we are moving so much online. We want to make sure that we're not doing that. Ensuring that your anti-malware and antivirus software on your computer is operating and up to date, and also making sure that your operating systems are up to date as well. This is just another good protection to keep some of these things from even getting to your staff. And then if you are considering an offer that you've received and you checked out the website, check online reviews of any company that's offering these products or supplies. I think that's a good idea for anything that you're contemplating buying online. But if you're not familiar with that vendor, do some due diligence and make sure that they are a reputable company. All right. So some of us last week attended the OCR COVID-19 webinar that was put on by the OCR. And some of you on the call may have done that as well. I'm not going to go into a lot of detail about that because we've covered those things before, and it was good to know that the information that we've been providing was the same information that was being provided from the OCR. That's always a good thing. So the things that I took away from that and others that attended that webinar did was the fact that there were a lot of questions related to text messaging and email and things that other options for being able to provide telehealth. And so they did answer that question and that was actually in one of their FAQs, is that they described different alternatives for telehealth. And it's not just doing something through Skype or Zoom, but text messaging and email are also methods that can be used. So the thing that I want to mention here is, if this is something that you have not been doing in the past, but now you're doing it, or maybe you were doing it in the past, but it had not been a part of your HIPAA compliance program, maybe not included in your SRA, you need to be addressing those things, because even though we're under enforcement discretion right now, that's going to go away at some point. And that was another thing that was mentioned. Penalties will be enforced for violations of HIPAA after enforcement discretion. Now, anytime there is any type of enforcement action, the OCR does take several factors into account. And they did indicate that they will take the public health emergency into account when they are investigating any type of violation. But the other thing they're going to take into account, which they always do, is systemic non-compliance. So for example, if we're under enforcement discretion right now, and you are offering telehealth through text messaging and you're texting patients back and forth, but we've not included that in we don't have any HIPAA protections on that. We're not compliant with it. Now we're out from under the public health emergency and there's a problem, and the OCR is investigating that. If you historically have your ducks in a row, you have been compliant, you have good policies and procedures, you've been doing your SRA, but this one piece during the public health emergency and maybe for a little bit of time after was not included, they're probably going to take that into consideration that you were in compliance prior. But in a lot of these cases, when they start investigating, they determine, well, there hasn't been an SRA done in the last 4 years, or there's never been one done, or it's not been adequate. So these are the things we want to remind you about as we are moving forward, that you do need to be looking at areas that can get you in trouble from a HIPAA standpoint after the public health emergency is over and we're out from under the enforcement discretion. And we'll talk a little bit more about this next week, but those key areas are your business associate agreements, your security risk assessments, and then updating any policies or procedures. So at this point, I'm going to hand it over to Chad and let him talk about some information from the CDC.
All right, great. Yeah, we're looking forward to covering some of those topics next week, and we'll also, expand on the CDC recommendations as well as those continue to come out. But for now, what we really want to talk about with the CDC is how they've added 6 new symptoms. We were all familiar with fever, cough, shortness of breath, and difficulty breathing. Well, now the CDC has come out and said, okay, here's 6 more that we're going to add to the list. And by the way, we have actually updated our modules with this information, so this has been added to those COVID courses if you do have those, but just wanted to share that. But the first one is chills. They added chills to the list of 6. Repeated shaking with chills is another one. Muscle pain, headache, sore throat, and new loss of taste or smell. I thought that was an interesting one that they've added. And these are some symptoms that they're seeing across the board with patients with COVID-19. Another one that isn't on this list yet that you've probably heard about in the news and such is COVID toes, or what is being touted as COVID toes. And basically it's a rash-like symptom that they're seeing on some feet of some patients who are presenting to the office. And so that one hasn't been added yet. They're still investigating it, but there is a possibility that the CDC might consider adding that one to the list at a later time. For now, though, we have provided the link on this slide, so you're welcome to, as you access these slides after the webinar, you can go ahead and click on that and updated symptoms for some more information, or you can refer to our course. And next, we want to talk about the Department of Labor. They've issued additional respirator guidance. We knew this was going to be coming out. And a lot of this guidance was based on enforcement guidance, basically on reusing the disposable N95 respirators that have been decontaminated. So once they've been decontaminated, how can you reuse those? Well, the National Institute of Occupational Safety and Health identified research that suggests there are some methods that show promise for decontamination. And these types of methods are vaporous hydrogen peroxide. We've seen good results with that. Ultraviolet germicidal irradiation is another one. Moist heat, like in an oven type method. Or microwave generated steam, or even a liquid hydrogen peroxide could be suitable. So they have a whole list of things on this release that they published. Once again, we're providing the link here. We'll cover this a little bit more next week as well. And this information is also being added to our courses as we speak, so that will be there. But we will also, issue some policies and procedures to help your organization with that. Next slide, please. So right now, CDC has issued these strategies, the following strategies for face masks. Now, typically, most healthcare organizations under the conventional capacity strategy, which is simply, every day we have plenty of supply of these products, whether it's face masks, face coverings, respirators, those types of things, not at risk really of having to come up with some alternatives. So that's just your normal day-to-day operations prior to, say, like this pandemic. Now, a lot of organizations that we've talked to seem to find themselves somewhere between contingency capacity and crisis capacity, or maybe they're in, either one periodically. But basically, the contingency capacity is when there's changes to the normal or your conventional capacity. And this is what we've seen right now with COVID-19 and why there's been so much guidance coming out on face masks is due to the shortages. There aren't enough for healthcare personnel or patients, and different guidance come out on how to mitigate that risk. And then there's also the crisis capacity, which is the next step up from contingency. And this is, when it's not commensurate with the US standards of care, meaning that it's a combination of these measures may need to be considered during periods of known face mask shortages. And on the next slides, we'll talk about this a little bit more in depth. So under the contingency capacity, what the CDC is saying is we need to implement extended use of the face masks. And the way that we can do this is by advising healthcare personnel to wear the same face mask for repeated close contact encounters with several different patients, and without removing the face masks in between patients. Definitely something new that you wouldn't see under normal circumstances, but due to the shortage, these are the recommendations that CDC has decided, like removing face mask and discarding if soiled, damaged, or hard to breathe through. At that point, it's acceptable to remove it. You probably need to get a new one at that point. Healthcare personnel should do their best to not touch their face mask. I know it's habit for all of us. That's the biggest thing, is learning not to touch our face and washing our hands and those types of things. Well, the same is true with the face mask. So they're advising, please do your best not to touch those. But if you do, just remove it and immediately perform hand hygiene. As we've seen, that's been one of the #1 recommendations. Finally, leave the patient care area if the face mask needs to be removed. So that's where it would be best during this contingency capacity. Normally, we might have done some different procedures, but now due to the risk of COVID-19, that's what they're recommending. Now, restrict face masks to be used by healthcare personnel rather than patients for source control. Patients with symptoms of respiratory infection can use tissues or other coverings. Most patients are wearing coverings as they come in. We're hearing reports that some organizations are saying, and it's even recommended from the CDC, that patients, when they show up to your facility right now, have some sort of face covering on when they come in. So that's been a recommendation that we're seeing, and most states, I believe, are implementing that as well. Next slide. Now, the crisis capacity takes it up even another notch. So this is when there is you don't have access to very many face masks, or maybe even none at all. And you might have to come up with some different alternatives. And some of these suggestions have even called for reusing face masks. And so they're talking about this as their limited reuse of face mask guidance that they've published. And with this, what they're saying is they understand that not all face masks can be reused, but if they can, there are different tips for decontamination, as we talked about on other slides. So, if it's soiled, once again, they want you to discard it, or if you can't breathe through it, that kind of thing. Once again, leave the patient care area if you need to discard your mask or take it off. And finally, to store or carefully fold so that the outer surface is held inward. That's another recommendation for it. So we have a whole list of all these recommendations that we're going to be publishing, and we'll be talking about this in more depth on the next webinar, but we just wanted to give you a heads up of some of the stuff that we're going to be talking about. One of the other things that they came out with was prioritizing face masks for selected activities. So when do you actually need to use them? Traditionally for a lot of healthcare organizations under normal rooming procedures, you wouldn't necessarily use a face covering, but now due to the exposure risk, healthcare personnel are advised to use face coverings or face masks. And under crisis scenarios, they're saying you might have to come up with some different solutions. So maybe you'll save your face masks for those essential surgeries or procedures, or if there's any splashes, but maybe under normal rooming procedures, say for a patient, you might not necessarily use that face mask just to help you get through and make sure you have enough for those situations that pose the biggest risk. I think that's the biggest takeaway on this slide. Okay, so the next slide, please.
All right, thank you very much, Chad, for going over that information. And like Chad mentioned, we are going to be including a lot more information in our next week's webinar to get everybody kind of back to work. So I want to touch on the Families First Coronavirus Response Act and the requirement for employers to provide, or certain employers to provide, paid leave for their either paid sick leave or expanded family and medical leave for specific reasons that are related to COVID-19. So for the first 30 days of the act, there was non-enforcement. Now that has ended. This particular period was just because this was so new, and it's hard to get all this information out. And so the Department of Labor did allow this period for the opportunity to provide additional guidance and education and to push this information out to employers. The education piece is still going to continue, but the enforcement piece is also coming with it. So employers will now be subject to penalties and enforcement if they are violating providing the first 2 weeks of paid sick time or if there's unlawful termination based on the provisions in the Family First Coronavirus Response Act, or if there's violation of the additional 10 weeks of paid leave to care for a child who has no care that can be provided. There is lots of information available at this link, but we did want to update you on this because this happened not too long ago, and we're outside of that enforcement. I mean, we're within enforcement at this point. So a couple of other things that came out that we want to share with you is the OIG has put some new frequently asked questions related to financial arrangements in regard to COVID-19. I just wanted to kind of give you an idea of the types of questions that are being asked. The response from the OIG, as you can imagine, is way longer than we have for this particular webinar. But I do want you to know that you can go out here and look at these questions. They are just for informational purposes. If you have a particular financial arrangement that you are unsure if it might violate the Stark Law or the anti-kickback statute, then you always want to get legal advice on that. But you can go and look at these questions to get a good idea of what the OIG is saying is permissible, again, during or related to COVID-19. One that this one, let's talk about this one that's on the screen. Can an oncology group practice provide free in-kind local transportation to and from an established patient's home to an alternate practice location to receive medically necessary oncology care during the time period subject to the COVID-19 declaration? And so in that particular case, this was an oncology group that had multiple locations, but they had to conserve their resources, so they only had one location open. And so they wanted to know, can we get our patients to and from this location that may be farther away from them? And is this going to be a problem? And I will give you the summary short answer, but I would encourage you to go and look at this if this is something that might impact you. The short answer from the OIG is, based on all of those circumstances and COVID-19, this is permissible at this time, subject to change. So, I mean, we have to think about all those things anytime there's a question like this. But I did think that was interesting. A couple more, and I'm not going to go into these specifically, but the one I want to look at here, just mention, is the second question: can a hospital provide access to its web-based telehealth platform for free to physicians on staff to furnish those medically necessary telehealth services? And again, this is during the COVID-19 time. And again, the OIG looked at this and said, okay, based on these circumstances, we think this is permissible at this time. And keep in mind that the individuals the groups that are asking these questions, that's an opinion that is directly for that group. So you can't take this information and apply it to you specifically. You need to look at your situation very specifically, and again, do get some legal advice on this. But we just wanted to let you know that the OIG is showing some leniency here with situations that have not that have been violations of law previously. So the last thing we're going to talk about before we kind of preview next week is the Accelerated Advanced Payment Program. And, you know, there has been a lot of money that has been provided through this program, but as of April 26th, CMS has decided to suspend any payments to Part B suppliers, and they are reevaluating any amounts that will be paid to Part A providers, such as hospitals, under the Accelerated Payment Program. So no new applications will be accepted on the Part B side, but they are looking at any new and pending applications on the Part A side. But the reasoning they provided is that they had expanded these loan programs. And remember, these are loan programs. So this is money that has to be paid back, and it will be taken out of future claims. And if you don't have enough claims, then there are other repayment methods, but specific rules to that. But the reason they did that was to get money necessary out to providers so they could continue to provide care. Now that we are seeing money coming from the Provider Relief Fund, CMS is saying, well, it looks like you guys are getting some money over there, so we're going to put a halt on this program. So that's really where we are at this point with this particular program. So far, as I mentioned, there's been $100 billion in payments out of this program. Part A has received almost $60 billion with dispersed over 21,000 applications. Part B providers have received a little over $40 billion and at almost 24,000 applications. So there were quite a few organizations that did apply for these advanced payments. Now, as I mentioned, the Provider Relief Fund earlier, we've talked about this a couple of times, so I did want to give you an update on this. The initial $30 billion has already been distributed, and that required no application process. It just went out based on what your Medicare receipts were from 2019. So they are beginning, or they started on Friday distributing the additional $20 billion. And for those of you who may not have been on the webinar last week, and just as a reminder to those who were, the CARES Act Provider Relief Fund attestation portal, which you are required to complete, is available at this link. So I did want to remind everyone that if you have received funds and you're going to keep those funds, you need to, and you don't want to repay them, then you have to go and attest on this website, and you have to do that within 30 days of receiving those funds. Now, a couple of things that I wanted to go over, because this was in a new FAQ that was provided by HHS, and this has to do with general distribution versus targeted distribution. So for you to be eligible for the general distribution, you must have billed Medicare in 2019, which we've talked about, and provider provided after January 31st diagnosis, testing, or care for individuals with possible or actual cases of COVID-19. This was something that we talked about last week. There's not been a lot of clarity. There's been some confusion about who is actually a COVID-19 patient. So I did want to point this out. This was in the FAQ, and in bold, that's my emphasis, not the emphasis of HHS, but they say they broadly view every patient as a possible case of COVID-19. So that it provides a little bit more clarity than what we had before. But if you did receive this money, you do need to look at those terms and condition or terms of agreement to make sure that all of them apply before you attest. Now, the targeted distributions. Healthcare providers may be eligible for additional payments, and these are payments that they're being targeted for different types of situations. So there's an allocation for the treatment of the uninsured. High impact areas has a different allocation. Rural providers, those have additional funds that are available to them. Even though you received money already, you can apply for targeted distributions. But if you're going to do this, you do have to submit tax documents and financial loss estimates if you want to be eligible for the additional funds. And so we thought that this would be helpful for you to know. Another reason of the targeted distributions, you have a lot of healthcare providers that don't submit a lot of Medicare claims. You've got pediatricians, you've got children's hospitals. And so there are also targeted distributions that have been allocated for those specialties as well. So if you have additional information, there is lots of information at this link right here. I would recommend that you take a look at that and see if you qualify. So now that we're here, and now that the world is beginning to reopen, what do we do with that, and how do we move forward? Well, the first thing I want to talk about is the guidelines for employers in all phases. If you look at the different phases, and I know many states they have their own phases, different from the phases that were introduced by the Trump administration, but I think these are still good things to think about. So for all employers, there will need to be new policies and procedures created. This is just a sample in regard to infection control and prevention. But as we've talked about many times on our webinars, there are a lot more policies and procedures that are probably going to need to be created, not just from a written standpoint, but actually putting them into action. And so with that being said, we want to talk about next week's webinar briefly, and then we'll open it up for questions. But next week is going to be really next steps for returning to work. This is going to be a special webinar. It may run a little bit longer than these webinars have traditionally been, but we want to cover topics that are relevant to your day-to-day when you guys are back in business. And you may, like again, I've mentioned, you may already be back in business, but we want to help you work through some of these things. The topics that we are planning to cover at this point, but they're subject to change, because if something big comes out between now and next Tuesday, we want to focus on that. We want this to be relevant. So you can see the topics that we're going to discuss, but really, I mean, you guys can help drive this webinar too. I see that we've got we've got quite a big attendance for this particular webinar, so we would love to start getting in some of those questions. Chad, would you like to speak to next week's webinar for just a bit?
Yeah, I mean, we would love to have input from our clients and even those who aren't clients who might be on this webinar as to topics that you'd like us to cover next week. We're definitely going to have policies and procedures that we're going to recommend having in place, different training topics that we want to make sure we're covering. I know that it's Tuesday, May 5th, so it is Taco Tuesday next week, and it falls on May 5th, but we won't be providing tacos. I wish we could. But we will try to provide lots of policies and different things like that for everybody. So, you know, PPE, social distancing, we're going to talk about that. Contact tracing, we're going to talk about a little bit. There's some, you know, different opinions on that, but we are going to make sure to touch on it. Telehealth, I mean, that's a big one for every organization. We're going to be sure to really help you understand that. We do have policies and stuff in place already for that. The most recent policy we put together, though, is specifically for PPE and how to manage that and what should be used. So if you would like that, we do have that available in our toolkit. Human resources, that's been one of our big questions, what to do with these employees. Let's say you have an employee who doesn't feel safe yet to return to work, even though they've been deemed as essential. You know, what are some ideas for helping manage those scenarios? So we'll talk a little bit about that. And of course, remote workers, we expect a lot of organizations to continue with remote work. And you know, that's still part of the guidance that we're seeing from the government. So we just want to help navigate that and cover any additional topics and challenges that you're facing. So we do encourage you to please submit anything that you want us to address, anything that you feel like you might be missing a policy on. All those types of considerations are things that we'd love to cover next week.
Absolutely. And I mean, who doesn't love a good policy in place of a good taco on Taco Tuesday? It's also Cinco de Mayo, right? Am I right on that? Is that right? I don't know. Anyway, we unfortunately cannot provide tacos, but we can provide policies and other assistance. And it looks like we might have quite a few questions. So let's kind of switch gears, and Nicole, do you want to give us a couple questions?
Yes, absolutely. Okay, so a few that have come in here. With traditional summer vacation fast approaching, how will this affect FFCRA? Will we be responsible for paying staff who has no care in place for their children over summer break, or will it only be if they do not have daycare opened up in our community?
That's a good question. So my thought on that is, if it's still due to the fact that there is no child care that is being provided due to COVID-19, then I think the answer is the same as whether it's in school or out of school. Because the employees, if their kids are going to be out for summer vacation, they would have made arrangements to have care in place. So I think if it's a COVID-19 related reason why the child care is not available, I think it's the same. What do you think, Chad?
I would think the same thing. and it's it's similar to can they remain on? It's like the question that we got, and I'm just using this as a compare and contrast really to how the law works, but we had a question that they asked, well, would this still apply to the employee who wants to still stay on the leave because they don't want to return to work? And they had answered no. So I think in this case, it would be the same type of scenario. If the COVID-19 pandemic was still the consideration and results of that still be in place, then sure, it would be. But if not, it's like Loretta said, it would just be traditional carry on with summer vacation as normal.
Right.
Okay, another one here. How do we transition from all the waivers and exceptions to post-COVID?
Oh, that's a really good question, and that's one we're trying to help you answer, because there are a lot. And so I think it's important, to continue to plug into things like this, to keep up to date with what is happening as things change. I think anytime you start hearing any comments to the effect of the public health emergency, that there is no longer one, a public health emergency being declared, the OCR, the CMS, all of these organizations are going to be issuing information as soon as they stop, as soon as they pull the plug. So I think it's a matter of knowing how to stay plugged in and informed so that you're not overwhelmed. But I also think we know it's coming. We do. We all know it's coming. So let's prepare. Let's look at what we're doing right now, and let's start going ahead and looking at how do we continue to do this and be compliant. And that's a key part of what, great question, because that's a key part of what we're going to try to provide you guys next week.
Yeah, and I would just add that, I would think that everybody who's on this call has a degree of culture of compliance that's been already established in your organization, and you've been real cognizant of things that you're doing and following your policies and procedures and making sure your patients are taken care of, and your employees for that matter. So, I would expect that a lot of it will just be remembering to pick up those pieces and continue on with your efforts, and you'll be fine getting through this. So we're here to help, and we'll hope to address a lot of that next week for sure.
Great. We just have one more over here. Are there any specifications for UV light, as many choices online?
Oh, wow. Chad, I'm going to let you answer that.
Sorry, tell me again.
Are there any specifications for UV light, as many choices online?
So within that, as far as for decontamination of face masks, is that what we're talking about?
I'm not quite sure. They didn't provide additional.
Probably. Since I bet that is, since that's what was on your slide. Yeah.
So I believe on the website they do talk a little bit about the UV light, but I don't remember if it. Let me bring that up here just real quick.
Okay. Yeah, they said yes. It's
okay.
In relation to that.
I'll double check exactly what they said on that, because I did have that up. So give me just one moment here, and I will get to that just to see what they said on that. Bear with me.
Oh, and for those of you who, I think everybody, well, I guess if you're on, you didn't have trouble getting on today, but we did have to send a new link out. Also, feel free to share information about our webinars with others that you think it would be beneficial to, because like we've said multiple times, we want to be helpful. And again, if there are other questions, or if you don't have to just submit them now, please continue. Whether you're a client or not a client, you can still email us at support@HCPMD. If you want a question added to our webinar next week, or for us to do a little more digging into a particular topic, please send your suggestions, send your questions. We will take those into consideration and make this webinar as beneficial to the attendees as possible. And like I said, whether you're a client or not, send those topics to us, and we'll make sure that we cover them.
Yeah, and I would say that the recommendation for the UV light was only to, for the ultraviolet germicidal irradiation that they talked about, or the disinfection method that uses short wavelength ultraviolet. So that would be one of the recommendations that, yes, they did say is appropriate for face masks.
And we can send, I don't know who sent that question in, but we can send that link to that information so that you'll have that available as you're looking for those alternatives.
Yeah, and I believe it expands on it a little bit further, so we'd be happy to provide that in a response as well.
Great. Well, all right, everyone. We did go a little bit longer than normal today. We had a lot to cover. Again, thank you all for attending. Please send in those topics or questions, and we'll get those added into next week. But until then, we look forward to seeing you guys then. Take care and have a great day.